Hello again. So today we're going to be discussing the three most important muscles in your neck. Who knows, maybe the three most important muscles in your whole body. So we're going to be talking about the rectus capitus posterior minor, rectus capitus posterior major, and obliquus capitis inferior. So if these words are new to you, then this is vital listening to understand the upper part of the neck and its implications in people's health problems, people's health. If these are familiar words to you, then this should be a great review, and maybe we'll even expand your understanding of this important area of the human body. So let's start with the rectus capitis posterior minor. So it connects C1, the atlas, to the occiput at the base of the skull, so the upper part of the neck. Its action is to extend the head, and it plays an important role in head posture and stability. So its innervation, its nerves, come from the suboccipital nerve. That's the dorsal ramus of the C1 nerve. So the origin of the muscle is the posterior tubercle of the atlas, your C1. And its insertion on either side, left and right, is the medial part of the inferior nuchal line of the occiput. Now, rectus capitis posterior major. So this connects the C2, the axis, to the occiput at the base of the skull. So it extends, rotates the head, and again, innervated by the same nerve supply. So its origin is the spinous process of axis of C2, and its insertion is the inferior nuchal line of the occiput. So this will be lateral to the attachments of the rectus capitis posterior minor that we mentioned before. Now, obliquus capitis inferior. So this forms the inferior border of the suboccipital triangle. We'll show you this in a moment. So this rotates the head to the ipsilateral, to the same head side, and bilateral contraction causes extension of the head, the C1, C2 joint. So it works with the other suboccipital muscles to stabilize head in the C1, C2 joint. So critical in posture and spinal alignment at the upper part of the neck. So again, innervated by the same nerve supply. This origin comes from the spinous process of the axis, and then the insertion is in the transverse process of the atlas, C1. So as we can see here, these three muscles, the rectus capitis posterior minor here, left and right sides, quite medial, coming from C1 to the occiput. The rectus capitis posterior major, so it's a longer muscle, hence being called the major, comes from the spinous of the C2 to the inferior nuchal line, lateral to the rectus capitis posterior minor. Then we have that bottom part of the suboccipital triangle, the obliquus capitis inferior, coming from the C2 spinous to the transverse process of the atlas. So here's a dissection, so we can see rectus capitis posterior minor on the right side here, rectus capitis posterior major, and the obliquus capitis inferior. So this is a tensegrity model. So it's vital when you're looking at the human body. You understand the human body is designed along tensegrity principles. So a tensegrity model has struts, so solid beams, and it has cables, so flexible, sometimes contractile tissues that create stability and mobility at the same time. So the point we're making here is today is that we need to understand that your spinal cord, your central nervous system, is not floating inside the spinal column. It is actually hanging. So this is what we're going to be looking at next. So we're going to look at 11 research papers. So first, anatomic relation between the rectus capitis posterior minor and the dura mater. So this is from Spine Journal, 1995, so 30 years ago now. Connective tissue bridge between the rectus capitis posterior minor and the dorsal spinal dura at occiput C1 junction was observed in every specimen. So in the early days, some people suggested that these were maybe adhesions or abnormal tissues or anomalies, but as we'll see, they're actually part of the normal anatomy. So fibers of this connective tissue bridge are oriented primarily perpendicular to the dura. So when we're talking about the spinal cord being suspended in the center of the spinal canal, this is critical with these orientation and the structure of these fibrous attachments. So the thing they said was resist movement of the dura towards the spinal cord. So as I mentioned before, it's all about keeping that spinal cord in the optimum position and not being stressed or strained or compressed during normal or abnormal movements. So may help resist dural infolding during head and neck extension. So it has a very important function. Paper number 2, proposed etiology of cervicogenic headache, neurophysiological basis and anatomic relationship between the dura mater and the rectus capitus posterior minor. So we're talking Journal of Manipulative Physiological Therapeutics, 1999. So connective tissue bridges were noted at the occiput C1 junction between this rectus capitus posterior minor and the dorsal spinal dura. Again, similar to our last paper, perpendicular arrangement appears to restrict dural movement towards the spinal cord. So these connections in the upper cervical spine may provide anatomic and physiologic answers to the cause of cervicogenic headache. This proposal would explain the manipulation's efficacy in the treatment of cervicogenic headache. So we can see we've got normal anatomy, we've got the possibility of abnormal function, and then we've got the possibility of positive outcomes from our treatment. So paper number 3, investigation of connective tissue attachments to the cervical spinal dura mater. So we're now into the Clinical Anatomy Journal, 2003. So connective tissue attachments to cervical spinal dura mater originating from the rectus capitus posterior minor were evaluated. Attachments were found in all of the specimens. So this is normal anatomy we're talking about. There's substantial normal attachments, usually present. So paper number 4, connection between spinal dura mater and suboccipital musculature. Evidence for myodural bridge and root fritz dissection. You see, as this became more and more established, they gave it a name, these myodural bridges. So connections from the muscles to the dura. Again, we're in clinical anatomy, now we're in 2012. So the connective tissue link between spinal dura mater and the rectus capitus posterior minor was first described in 1995, as we've already seen, and has since been readily demonstrated via dissection, MRI, and by plastinated cross-sections. So the direct and anatomic link between musculoskeletal system and the dura mater has important ramifications for the treatment of chronic cervicogenic headache. So paper number 5, the obliquus capitus inferior myodural bridge. So again, Clinical Anatomy, 2013. So 14 muscles were isolated. All of them contain these fibrous tissue bands from the anterior portion of the muscular belly, which attach to the posterior lateral cervical dura mater by root of the C1-C2 interspace. So these fibers seem to merge with the fibers from the rectus capitus posterior major muscle, producing a single structure. So the thing they said was may play a physiological role in monitoring dural tension. So this is a proprioceptive sensory function and from preventing dural infolding. So that's a biomechanical function. May also contribute to certain clinical symptoms manifesting from alterations in dural tone. So we see this same 3 components here. It's normal anatomy, has important biomechanical physiological roles, and can be involved in symptomatology. Paper number 6, the histological analysis of the rectus capitus posterior major myodural bridge. So again, spine, back to Spine Journal 2013. So histological investigation revealed tendinous matrix inserting into both rectus capitus posterior major and the posterior aspect of the cervical dura mater in all specimens. So again, may be involved in monitoring dural tension, so proprioceptive sensory function. It may also play a role in certain cervicogenic pathologies. Paper number 7, systematic review of soft tissue connections between neck muscles and the dura mater, the myodural bridge. So Spine 2017. So soft tissue connections between the rectus capitus posterior minor, rectus capitus posterior major, and the obliquus capitus inferior muscles seems to be proved with a strong level of evidence for each one of them. So this continuity of the soft tissue between cervical musculature and cervical dura mater is very well evidenced. Might have physiological, pathophysiological, and therapeutic implications. So it can go some way to explain the effect of some therapies in craniocervical disorders. So 8th paper, rectus capitus posterior minor, histological and biomechanical links to spinal dura mater. So Spine 2017. So they investigated the connective tissue bridges histologically between the rectus capitus posterior minor and the dura mater. So biomechanical testing suggests this tissue link complex can reduce the bulging of the dura mater into the spinal canal caused during hyperextension. So potential mechanical function of this attachment may include stabilizing role of the dura mater during neck extension. Paper number 9, the orientation of property of fibers of the myodural bridge in humans. So Spine 2018. So they say all of these studies over the past 20 years have revealed fibrous connective tissues between suboccipital muscles and the cervical spinal dura mater. Myodural bridge might have important functions related to proprioception, keeping the subarachnoid space and cerebromedullary system unobstructed, and affecting the dynamics and circulation of the cerebrospinal fluid. So clinicians have found pathological change of the myodural bridge might cause cervicogenic or chronic tension type headache. And the myodural bridge, traversing the occiput C1, originated mostly from the rectus capitus posterior minor, whereas between C1 and C2, it came from all three of these muscles: rectus capitus posterior minor, rectus capitus posterior major, and the obliquus capitus inferior. So mainly formed by parallel running type 1 collagen fibers, can transmit strong pull from diverse suboccipital muscles during head movement. Paper number 10, anatomy and clinical relevance of suboccipital soft tissue connections with the dura mater in the upper cervical spine. So the Peer Journal 2020. In all cadavers, connective tissues attaching rectus capitus posterior minor to the posterior occiput C1 membrane were identified. The connection is collagenous in nature, and the spinal cord moves within the spinal canal during passive movements. Possible tensioning of nerve and ligamentous connections from these relationships. And our final paper, the utilization of magnetic resonance imaging and myodural bridge complex with relevant muscles. Current status, future perspectives. So here we are in 2020. So this myodural bridge is a soft tissue connective bridge that provides fascial continuity between muscular, ligament, and cervical spinal dura mater in the suboccipital areas. Would transfer tensile forces effectively from involved suboccipital muscles, ligament, to spinal dura mater during head movement. So they have a normal function of maintaining this central alignment of the spinal cord and the dural sac, and they potentially have a pathological effect. So here are our conclusions. There are well-proven connections between the rectus capitus posterior minor, rectus capitus posterior major, and the obliquus capitus inferior to the spinal dura mater. Researchers have proposed repeatedly an important biomechanical and neurological role for these connections. And they've also made connections between abnormalities in these connections and cervicogenic symptoms and other signs of dural tension. So hopefully you've enjoyed this short chat about these important muscles, and hopefully you can see the benefit of having effective therapy. To be honest, the best thing I've found is the 3D energy gun for really getting into these muscles, getting into this upper cervical spine, and releasing induration and contraction and trigger points in each of these muscles. So check it out a little bit more, and we'll talk to you again next time.